Patellar dislocation. Anatomy. The knee is the largest joint in the human body. Our knees provide stability and allow our legs to bend, swivel, and straighten. The knee is composed of 4 bones: the femur, tibia, fibula, and patella, or also known as the kneecap. The knee allows knee flexion, knee extension, lateral rotation, and medial rotation. What is patellar dislocation? Patellar dislocation occurs when the patella, which is a triangular sesamoid bone, slides out of the patellofemoral groove. As we can see, the patella in the after image is out of place. The knee appears to be deformed. Cause of injury. The cause of injury can be divided into external and internal factors. The first internal factor is patellofemoral joint hypolaxity, which means that the knee has an increased range of movement. The next factor is patellofemoral joint maltracking, which is an imbalance in the gliding of the kneecap. The third factor is weak inner quadriceps muscles, as it will fail to hold the patella in place. Next is tight muscles and connective tissues around the knee, such as tight lateral retinaculum, iliotibial band, hip flexors, vastus lateralis, which is a thigh muscle, and biceps femoris muscles. These will pull the patella out of balance. Last but not least, shallow patellofemoral groove, as it enables the patella to slide off easily. The external factors include a direct blow to the knee and a sudden twisting of the knee. These often occur when doing sports such as football, golf, ice skating, basketball, and many more. Symptoms of patellar dislocation includes the deformity of the knee, lack of mobility, inability to straighten knee, severe knee pain and tenderness, sudden swelling and bruising, and hypermobile patella or sloppy kneecap, which means that the knee has an increased range of movement. When the patella is dislocated, the knee is vulnerable to the fracture of patella, osteochondral fractures, or in other words, fracture of bones and cartilage around the patella, chondromalacia or abnormal softening of cartilage, late degenerative osteoarthritis, and recurrent dislocation. After having the doctor relocate the patella, PRICE or PRICE and physiotherapy should be done to promote recovery, which would take about 6 weeks. First, protection. Stay away from sports and strenuous activities. Second, rest. Third, ice. Fourth, compress. An ice compress should be used on swelling and bruises for 10 to 15 minutes per hour for the first few days of recovery. Finally, elevation, to allow the knee to regenerate quicker. Physiotherapy exercises that should be done is hip flexion and extension, or commonly known as leg raise, and hip abduction and adduction, also known as side leg raise. Next, knee hyperextension, and lastly, knee flexion and extension, or better known as step up and step down. Physiotherapy can increase the flexibility and strength of the knee. I hope this helped. Thank you for watching.